Gout is a type of debilitating inflammatory disease that causes excruciating pain. But the good news is that there's something delicious that can lower the risk of recurrent gout attacks. So let's start out talking about what gout is and its causes and associations.
Okay, gout is really a disorder of purine metabolism. What does that mean? That the breakdown products of DNA, RNA, adenosine triphosphate, which is what energy is in the body, and other substances leads to a concentration of uric acid because it's the last product that's made. It's the waste product of purine metabolism. So we have increased amounts of uric acid forming, which can occur if we have the genetic predisposition for gout, but also in situations where we're taking drugs like the thiazide diuretics or loop diuretics. It can raise levels of uric acid a lot. So can things like malignancies, cancers of different kinds, particularly leukemias and lymphomas, because there's a rapid turnover of cells.
And what about diabetes and metabolic syndrome?
Well, they could be associated with it. I mean, when we talk about fructose, for example, we're looking at an increased production of the amount of uric acid that the body makes, and that can lead to type 2 diabetes and the other conditions you're talking about.
And don't many times people, too, that have hypertension have gout?
They can. It's a common thing, particularly if they're treated with thiazide diuretics, which is a very common thing that we use for that. So when we have the production of a lot of uric acid, it does a few things to the body. It actually works in 3 areas. One is it tends to crystallize in our joints, especially the joint of the big toe. And if it does that, then we have pain because there's a lot of inflammation, and that's usually how it presents. But it can affect 2 other areas. One is if we have high amounts of uric acid in the urine, because we have high amounts in our serum and we're excreting it.
I'll bet you get kidney stones.
You got it. You can get kidney stones from it that can be very painful. And the other thing that can happen is you can have the crystallization of uric acid in the kidney itself, causing kidney disease, renal insufficiency, and even renal failure sometimes. So it's a disease of joints, of the urine, which causes uric acid stones, and of the kidney itself.
So let's talk about this exciting study with Cherries, because diet is very important if a person has gout or the tendency to have recurrent gout attacks.
Right.
So people that ate cherries, 35% of them, it didn't come back, and 75% it didn't come back if they took it with allopurinol, which is the drug of choice for gout.
So basically what we're talking about is an article that was published in the journal Arthritis and Rheumatism. They had 633 patients that they followed for about a year who had gout. And they measured the number of attacks they had, and then they also looked to see if they had consumed any cherry products in the 2 days prior to the time they had an attack. Kind of a nifty way of seeing if the cherries somehow could have had something to do, because we've known for years that there's an association, but here now we have the study. And what it showed is that up to taking 2 or 3 servings a day of cherries reduced the risk of getting gout by about a gouty attack by about 35%. So that's something to think about. It'd be one of those natural things that may support lowering uric acid.
And you only have to eat 12 of them. I mean, and they're so good.
Yeah, well,
and if they're not in season and you can't eat them fresh, you can get them dehydrated. They're good sprinkled in salad and put them in muffins and so forth. They're just delicious. They taste like candy, actually. And you can get frozen ones, and you can get them in an extract or a concentrate, or drink cherry juice.
Exactly. Lots of ways to get it, and why not do it in a way that's kind of fun? So this whole business of gout, okay, is one that is solvable for the most part. We tend to use the drug allopurinol. Its trade name is Xyloprim. But keep in mind that we shouldn't start out by treating people with large doses of allopurinol if you have gout, because it tends to mobilize the uric acid crystals that are in the joint, which can increase inflammation. So we're inclined to use a drug called colchicine, which can be used to reduce the inflammation, usually within about a 24-hour period, and give pretty good results. But like every drug, they have potential complications. But in general, this is a wonderful way to approach managing the symptoms and lowering the risk for redeveloping gout, because allopurinol is a drug that blocks the production of uric acid. And if we have less of that around, of course, the risk for developing it goes down.
So you mentioned about staying away from meats because of the purines, and diet is so important with gout. So you really do need to to cut back on meat, especially organ meats. And also poultry and fish are included, and even gravy is included. But also limiting alcohol intake and fructose.
Fructose is a big one. We talked about that in another show we just did. And there's definitely an increase in the production of uric acid in people who consume a lot of high fructose corn syrup or sugar.
And saturated fats, they say to stay away from those, and also to choose complex carbohydrates like whole grains and vegetables and fruit and things like that. And low dairy also lowers the risk, and to drink a lot of water, which just sort of makes sense.
Yeah,
8 to 16, what was it? 8?
Well, that's a little excessive. You can drink
16 glasses a day.
I'd like to see somebody do that.
Well, that might wash out that uric acid.
Well, yeah, it may make you going to the bathroom about every 10 minutes too. But that's something to keep in mind. So when we look at the whole business of gout, we want to do the simple things we can that are non-invasive. And taking a few cherries a day, not a bad idea. Of course, you want to make sure that you're going to your doctor and making sure that your uric acid levels are below 6, that you're not putting a lot of uric acid out in your urine, and that you're not having other problems like kidney disease that can form with people who have this gouty arthritic problem.